A very good evening, everyone. I, Sahil Jaiswal,
And I, Twinkle Muralka.
the students of New Delhi Institute of Management, PGDM Batch 2022, welcome you all to today's webinar, Staying Healthy Through Future COVID Wave, Essentials, Do's and Don'ts. We would like to thank each and every one of you for taking out time from your busy schedule to be here with us this evening. Today, we have with us 5 super specialty doctors, including 3 Padma Shree awardees, to guide us on how to brace ourselves and intelligently prepare for the probable third wave of coronavirus and the truth behind myths related to the pandemic and its treatment.
NDIM is known for providing the finest internships and life projects to its PGDM students and has been declared best in India for industry linkages, students' employability, and the corporate environment by all the Apex National Commerce and Industry Chambers of India continuously for the last 5 years by SOCHAM, CII, and FICCI, including AICTE, Government of India, Confederation of Indian Industries, and AICTE, Government of India, jointly declared us as the first and only mentor B school of India for a period of 3 years.
Without further ado, let us introduce our eminent panelists for today's webinar. We will be going in alphabetical order. Our first speaker for today is Padma Shree Dr. Balbir Singh. Sir will be joining us a little late, but I would like to introduce him. Dr. Balbir Singh is currently the chairman and head of cardiology, Max Super Speciality Hospital, Delhi. Prior to this, he has been associated with AIIMS as faculty and practiced at leading hospitals like Escorts Heart Institute and Indraprasth Apollo, New Delhi. Dr. Singh is the president of the Indian Heart Rhythm Society and has served as secretary of Cardiology Society of India. He is regularly invited as faculty on international platforms. His work is published in national and international journals. Dr. Singh is presently on the steering committee of 3 large multi-center international trials. Sir has been awarded prestigious national and international awards. He was honored with the Padma Shree by the President of India in 2007. We welcome you, sir.
Our next speaker for today is Padma Shree Dr. Harsh Mahajan. Dr. Harsh Mahajan is the founder of Chief Radiologist of Mahajan Imaging Private Limited. He is currently the chairman of Center for Advanced Research in Imaging, Neuroscience and Genomics, and Department of Nuclear Medicine and PETCT, Sagangaram Hospital, and consultant at International Atomic Energy Agency, Vienna. After completing his MD in radiology from PGI Chandigarh, he won the Rotary International Scholarship and went to Anderson Cancer Center in Houston, Texas, USA, to do a fellowship in MRI. Dr. Mahajan travels widely to deliver lectures on clinical application of the latest cutting-edge technologies. He is regularly invited as a speaker on international platforms like MIT Boston, Radiology Society of North America, Chicago, European Society of Radiology in Vienna, just to name a few. Sir has been the doctor to several presidents and prime minister of the country. He has received many accolades and awards, including Padma Shree. We welcome you, sir.
Our next speaker for today is Dr. Romel Tikku. Dr. Tikku is currently the Director, Internal Medicine at Max Healthcare, New Delhi. Sir is an eminent internal medicine specialist with over 2 decades of experience. He has vast experience in handling the infectious diseases and has played a pivotal role in handling H1N1 and COVID-19 patients. Dr. Tikku has been at the forefront in the fight against the deadly virus, making himself available round the clock for online consultations. He has played a major role in increasing the awareness among the public by providing vital information on COVID-19 through electronic and print media. We welcome you, sir.
Our next speaker for today is Dr. Sameer Parekh. Dr. Sameer Parekh is the Director of the Department of Mental Health and Behavioral Sciences, Fortis National Mental Health Program. He heads a team of 80 experts at 20 centers across India and has reached out to 15 crore lives. He has been an advisor to International Mental Health Project with Pacific International Hospital at Papua New Guinea. He has worked extensively with children and has a strong emphasis on preventive mental health and skill building. Sir has authored several books. Dr. Parekh has been awarded Bharat Panchal Award for the best young researcher in the field of psychology, and he has a strong presence on social media and has an outreach of over 100 million lives a year since 2019. We welcome you, sir.
Our next speaker for today is Padma Shree Dr. Sanjeev Bagai. Dr. Bagai is the chairman and MD of Nephron Clinics in Delhi. He is currently visiting professor at the University of Ohio, United States of America, and Montreal in Canada. Prior to this, he has headed various renowned hospitals like Batra Hospital, Dwarka Manipal Hospital, etc. Dr. Bagai is a gold medalist and has done his MBBS, MD, DCH, DNBE, and MNAMS in pediatrics from Bombay, India, fellowship in pediatric and pediatric nephrology from Sydney, Australia, and received his PhD in pediatric from University of Delaware, United States of America. He is an expert in pediatric nephrology and kidney diseases. He has been conferred numerous awards like the Padma Shri Award, Dr. B.C. Roy National Award, Medical Ratna Award, Lifetime Achievement Award IMA, just to name a few. We welcome you, sir.
Allow me to introduce today's facilitator, Mr. Amod Kapoor. Mr. Amod Kapoor is a consultant, public relation and media planning, a self-motivated professional in the field of media, films, both audio and video, with experience of more than 30 years. He has enormous exposure to the challenges of media planning with hours of predictable social programming on various platforms, including the public broadcaster. We welcome you, sir.
Allow me to introduce today's host, Dr. Vishwa Mohan Bansal. Dr. V.M. Bansal, Chairman, New Delhi Institute of Management, is a former civil servant and has been the youngest and the longest serving secretary, commissioner, principal commissioner, and director of India's biggest statutory urban body, DDA, Government of India, for 28 years. He has headed several public sector undertakings and was advisor to the Lieutenant Governor Delhi at the time of Commonwealth Games 2010. He is the chairman of Education Committee of the PhD Chamber of Commerce and Industry. May I request Chairman Sir to take over?
Thank you, Sahil, and thank you, Twinkle. It's a pleasure hosting such an esteemed and very distinguished panel of most sought after doctors of the country. I have been seeing a lot of TV appearances of theirs, but I think having all of them together is perhaps the honor and privilege goes to us and the host of the day. Thank you very, very much, each one of you. And it's a pleasure and honor once again, I repeat. It's not easy to have people like you to take out time out of your such a busy, hectic work schedule to speak to our participants and attendees today. And it's a very warm welcome to all the attendees. I just need to introduce the panelists that the attendees today are about 40 to 45% are the students across the country. About 25% is the academia across the country from every kind of a college and university. And another 35% people are from the industry, from the corporate world, from the startup world, and the doctors from different fields. And with your permission, I'll request Padma Shri Dr. Harsh Mahajan to kindly moderate the session so that he will be able to really take care of what exactly is behind everybody's mind, what is bothering, what is the question in each one's mind, because they are seeing the people every day. So requesting you, Dr. Mahajan, to please take over.
Thank you very much, Dr. Bansal, sir. It's indeed both a pleasure and an honor to be present in this webinar, which has such a diverse group of people who are participating in it and across the country. And number one, I would, suggest that if they have any question, they should put it in the chat box and we will try to reply to it. Though we have such an esteemed panel with us today that I'm sure in the deliberations, most of your questions would be answered. We've seen the devastation that COVID-19 has caused. we saw that when we had only about 550 cases in March of 2020, on the 25th, from there we had a big lockdown. Despite the very strict lockdown, actually, the cases continued to rise. But that gave the country time to get its healthcare infrastructure into order so as to face this wave, and the requirements for infectious disease, and that too a highly infectious disease, are very different from what we have in a general hospital. So a lot of changes need to be made very quickly, and it was due to the lockdown, which at times we felt very uncomfortable about, that the first wave was as small as it was, and that we were able to actually handle, the medical fraternity was able to handle the problem very, very well. The second wave, of course, overwhelmed us, and it was because, as we learn, these viruses mutate. Everyone knows now about what mutation is, and we'll delve more into that. And then onward to where we are today and where we are going to go. The topic of today's webinar is staying healthy through future COVID waves, essential do's and don'ts. And to remain safe in the future, I think we have to learn from the past. And so my first question is to Dr. Sanjeev Bagai, who has done extensive work, extensive reading, extensive lecturing, both within the medical fraternity as well as to lay people through media, through television, through newspapers, uh, education, awareness. So, Dr. Bagai, I would like you to take us through what happened, how it started, what we did right, what could have been done better, and what was the difference between the first and second waves, and how did we end up where we did? Dr. Bagai, please.
Thank you, Harsh. Thank you, Harsh, for your kind words, and thank you, the organizers, Professor Dr. Bansal, Amod, and everyone on panel. Good evening, everyone. So I think this is something which all of us have experienced for the first time. We didn't realize that the fire is going to hit the roof in December of 19, where it actually started. And till date, we don't really know the origin. As far as pathogenesis, where it actually began from, whether a lab or a live market. We had the first lockdown on 23rd March in 2019, and then going in 2020, and then on 24th, it was a full lockdown. It was something which was a first time experience for most of us. None of us have actually seen the last pandemic 100 years back. There was a lot of discussion on and we were caught actually unaware. A lot of discussion on the usefulness of a lockdown. Should it be there, not there? There were issues with regards to PPE kits. There were issues of first time of actually developing an RT-PCR, because we didn't have the RT-PCR at that time. It was the first time experience for most of us to be wearing an N95 ourselves all through the day, literally. And then, of course, it was a question of what to do. So it was a self-learning experience. A lot of the drugs which were commonly heard of and commonly spoken about ultimately didn't turn out to be that good, including drugs like HCQ, including even recently as a couple of months back, was the plasma therapy. So I think it was a self-learning curve. No one really knew what is going to happen. Towards about 7 or 8 months back, it was a full discussion on the vaccine which was going to start, and luckily India is one amongst the first 5 countries which has a vaccine now, not one but 2, which is indigenous. And then, of course, was what to do with the patients when in the hospital. We can't go any further, Harsh and Rommel and Samir and Balbir, to any length of discussion unless until we actually pay our condolence and our homage and our respect and deepest prayers to more than 1,550 doctors who have died in the first and the second wave. We lost about 750 brave hearts in the entire length and breadth of last year. but we lost about 770 doctors just in the 9 weeks of this year. And that is how devastating this second wave was. There was a lot of discussion on what the original virus was and how it has mutated. We'll discuss this as we take the flow along. Now we know that the new kid on the block is Delta, which is taking everyone's life away in most parts of the world. And now, of course, is to deal with the patients who are in the hospital, what is to be done. We realized that ventilation was not the best thing to be done. We realized a lot of drugs which we were using were actually not that useful. And to manage the long COVID, there are lots and lots of patients who are now suffering from the long COVID. We also realized that asymptomatic carriers can be as lethal as the disease spectrum because they carry the same viral load. We also learned that children are not immune to this disease, and children, in fact, have a different phenotypic experience with COVID. And now going forward is to get ourselves ready and prepared so that we don't face the avalanche of the third wave. So we have to really go back to the basics. We have to have a very, very high level of vigilance. We have to have a great commitment to wear a mask. I've said this on many forums that the virus is the RNA, but we have to make DNA our main base to wear a mask. So our DNA is a mask to keep the RNA virus away. We have to focus on testing. We have to focus on gene sequencing, because unless until we don't know which type of phenotype is floating in which part of the country, we may be.
Yeah, we'll talk about that, Sanjeev, as we go along. This is just putting, things in context. And sorry for barging in, but I take it now to Dr. Rommel Tikku, who's the director of internal medicine of the Max hospitals. Now, what has been the learning for you? You were right at the forefront, both in the hospital as well as you were trying to reach out and be helpful to as many people as you could online. How did your practice of medicine change during this 15 months? And currently, what is it that we have for treating illness, mild, moderate, and severe?
Well, thank you, Dr. Mahajan. Good evening, everyone. So the experience has been vastly different from what I have experienced in the past. I mean, with COVID, it was a new experience for all of us. Virtual consultations are something which we never did in the past. And we always thought that it has to be in the OPD, that somebody has to come here to examine. But because of the pandemic, we realized that half the work can still be done virtually. And even in the hospital, sometimes you would not go inside, because if you would go inside, you'll get exposed. So you have to do things from outside, which was basically doing a video consult. Most of the time, the team inside was taking care of the sick patients. I mean, we've never done it, but we had to do it because at the end of the day, you have to go to the wards, you have to see the non-COVID patients also. And then you go back home, you don't have time to relax. Basically, you have to do virtual consults. It used to start for me late in the evening at around 8, 9-ish, and it would go on till 3, 4 in the morning. And the next day, early morning, the phone would start ringing at 7, 8-ish. And everyone would be wanting to know, what is the scan showing? What is the CRP? What does it mean? Do we have to get admitted? Do we have to stay at home under home isolation? What are we supposed to do? Do we take steroids? Do we not take steroids? Do we take antibiotics? There was so much of confusion. I was handling, I think, at the peak, around 100 patients a day, apart from the hospital work that I was doing. And I tell you, it was unprecedented. I've never seen anything like that. And it was difficult, actually, and you're helpless most of the times. And also because of the fact that so many people got infected at the same time, that you couldn't reach out to everybody. I mean, I couldn't answer calls from my family at times because I had to do my virtual consults. I had committed to someone else. So this was something which we had never seen. But I'm glad that it ended as soon as it reached the sky. But it had to happen like that because so many people got infected at the same time. And again, now coming back to the experience, I mean, it is a learning experience definitely for all of us. And in the future also, we have to learn from it. And as Dr. Bagai said, and first wave, there was the pandemic, there was the lockdown, and we could sort of ramp up our infrastructure. The second wave, actually, exposed everything, the loopholes of our healthcare system. And we'll talk about it more, but coming to the consultation and the management part of it, and the hospitals, we had different teams. ICU was managing the critical cases. The ones who had mild to moderate disease were being managed outside. And virtually, we were managing patients on the phone. And basically, for asymptomatic patients, coming to the management part, you don't have to do much. Basically, you just have to stay in isolation. You have to wear a mask. You have to make sure that you're not exposing the rest of the family members, especially if they have comorbidities. And for basic things
asymptomatic is very, very important because generally people don't understand it. And as Dr. Bagai also said, asymptomatic people spread the disease just as much as symptomatic people. In the beginning, actually, it was thought that maybe asymptomatic, the viral loads are lesser and all that. But then later we realized. So suppose I've come in contact with a patient. What do I do?
No, if you have been in contact with a positive patient, you're supposed to quarantine yourself, and you're not immediately supposed to get tested. It's between the 5th to the 10th day of getting exposed to the positive patient that you have to get tested. Till then, you have to be in quarantine. Basically, you should not come out of the room. You can't expose the rest of the family members because you might become positive anytime. And if you develop symptoms, then you have to get in touch with your doctors. In fact, from day one itself, you should be in touch with your doctors and tell them that you've been exposed to this particular patient and I'm in quarantine. Am I supposed to do any tests? What do I do? Am I supposed to check my saturation? Am I supposed to check my temperature, the vitals, the do's, don'ts, everything? And that's very important because asymptomatic patients can also transmit infection, and you might not have symptoms and you would think that you don't have the infection. So for mild cases, as I was telling you, nothing much needs to be done. For moderate to severe, basically, what do you do at home? So once you have the report that you're positive, then you start sort of checking your vitals, your temperature, your saturation. And if your temperature is very high, persistently beyond 100, 102 for 2-3 days, and if your saturation is sort of dipping less than 93% persistently, and if you're coughing nonstop, not getting better, it's time for you to be hospitalized. That's moderate disease. And you don't have to rush and get your CT scans done. You don't have to start steroids because someone else has started it. Just be in touch with your doctors, check your saturation, check your vitals. They'll tell you which drug to start. There is no role of antibiotics now. We used to give azithromycin, doxycycline earlier, but no study says that it helps. It doesn't have any potential antiviral, anti-inflammatory effect. So monitor basically, and if you have all these symptoms, which are symptoms of progressive disease, then you need to be in the hospital, whether in the ward or in the ICU. Now, for moderate to severe disease, I would say most of them need oxygen if their saturation has gone down. Apart from that, it's basically steroids and it's anticoagulants. I think the maximum data as of now, which we have, is for steroids. They are the life-saving drugs in COVID, in severe, moderate to severe COVID. And apart from that, antivirals, remdesivir, though we don't have much data about it, plus minus. I mean, it reduces the hospital stay. It doesn't reduce the mortality.
Yeah, it's kind of become controversial. You have, now the ICMR and the government of India has actually taken it out of treatment. But there are those doctors who've treated hundreds and thousands of patients who still swear by it and say it does have some effect. So let me take it now to Dr. Balbir Singh. Balbir, are you there?
No, Dr. Harsh, had sent a message that he'll join after 20 minutes. He had some urgent surgery.
Okay.
He'll come back after 20 minutes.
Okay, that's fine. So, we've talked about how it all started. We've talked about asymptomatic disease, how important it is to isolate yourself. We've talked about mild disease, and when it becomes moderate or severe, based on the symptoms that Dr. Ikku has told, then you need to be in a hospital. And this is a decision which your doctor takes. I mean, what was happening actually, especially in the second wave, everyone was self-treating. And that also created a lot of problem. So now, since Balbir is not there, let me take it to Dr. Samir Parekh, who's one of the finest psychologists that we have in the country. He has a large group of 80 consultants who work with him. And Sameer, over this 15, 16 months, those who got infected and recovered, those who were in the same family, and those who did not get infected but had to stay at home or couldn't go to work, had to work from home. There are several categories of people. How did each one react, and what were you able to do to provide them relief, succor, a shoulder to cry on? How was it?
Dr. Mahajan, so many aspects to frankly what you said, and you've rightly actually compartmentalized it. That is the dynamics of the human mind, isn't it? One thing doesn't apply to everybody. In fact, one thing doesn't apply to the next person having the same problem as well. And when I was listening to the very famous Dr. Tikku, right? It takes me a while actually to say Dr. Tikku and not Romil. Since we are on the
You
right
can call it Romil here.
I know. Eventually. But no, I think
Abhi bacha hi hai.
Conversations that I had throughout the pandemic with Romil were therapeutic. I am hoping to him and a lot to me as well, which included when family was infected and extended family was infected, and every time I would realize, and especially I remember a Sunday afternoon conversation in the middle of the peak when Romil told me that I've not answered my dad's calls, and he's saying, "Aisa kya kaam kar raha hai? Tu mera phone nahi utha raha." And I think that's where we need to start from. And picking up from what Dr. Bagai had also said, no conversation on mental health with COVID is possible until the society understands the kind of pressures healthcare workers, providers, and doctors have gone through. It is most unbelievable. I've had conversations with doctors who want to quit. I've had conversations with nursing, paramedical staff who don't feel like working anymore. And we are still not realizing the aftermath, because I still feel it will take a lot many more months to realize the kind of aftermath that the medical community goes through it. And society needs to remember this and reminded of what medical practitioners have done here. It's humbling for a person like me who's been working virtually from home and working purely digitally. I can only be awe-inspired and humbled by people like Romil, Dr. Bagai, yourself, who've actually been there. So, people like us have been just backseat drivers with all the safety protocols. So it's just unbelievable. And I think we need to understand that there's been a lot of mental pressure on the healthcare community. A lot of frontline workers from the healthcare were very, very young people, right? Much younger than the very young Roman, right? And what that also did was that not any exposure. We also need to understand, and I've been saying this for a while, there is no training, sir, about a pandemic, right? There is no mention in books about a pandemic. The World War, count the World War deaths, count the previous pandemic deaths, and we'll wonder why do we teach World War and not teach the pandemic. I mean, even we didn't get training. I have had no training. We have no training. I did not know how to deal with the pandemic until the pandemic hit us. And frankly, I realized that my role as a clinician had to be a sub-part of my role as a communicator with the society, because positivity, optimism, hope, and responsibility at a societal level became so integral to the fight of pandemic. Otherwise, we would have had a lot more devastation than we wouldn't have been able to understand. That's one aspect. Second, all said and done, I think digital medicine came now. It's going to stay here, obviously. If digital medicine, telemedicine would not have started, we would have struggled so much, especially for people having mental health issues already. Because, that's a continuity of care that was required, sir. So what happens is that, you may be having, it might be a short consult for the next 3 months, continue with the same medication, but you need medications, you need a prescription. And overnight that change happened. What that also did was, actually for a change, accessibility became easy in a country like ours. So when my patients who would take 3 or 4 days to reach me, 2 months to book a ticket and apply for leave, could now actually on a click of a button do that. And I think that's remarkable, and especially for a country like ours, which has over 500% shortage of mental health experts. This is the solution, which is telemedicine. To the last part of your question, a pandemic is a pandemic because it's it affects everybody. There is no way we will not be affected. The impact may be different. A large tree may shake, lose a bit fruits, small tree may be completely swayed away, but that's how it hits, and that's what a pandemic is. So from children stuck at home, from senior citizens stuck at home, loneliness, isolation, anxiety, sleeplessness, uh, change in diet, change in pattern. I mean, so many people talk to me about sleep impairment, and I have just one answer to them. Your lifestyles change, of course, you'll be sleeping less. The kind of digital interface that happened, children who are stuck, schools, and then you look at people who actually went through the illness. It was also as much a nightmare to be hospitalized in a ward, in quarantine, with very limited access to so many things. And it's one thing when we talk about this in urban India. When you go further down, it became an even more different kind of a story. And then your family is back home wondering. So there's so much of anxiety happening. Then you come back, and then, it's a traumatic experience for the family. It's a traumatic experience for the individual. In between, you go through bereavement, loss of loved one. There is a grief that all of us have experienced at some distance or the other. So naturally, if impact on mood, impact on thought, impact on motivation, all this is happening. And as we are coming out of the previous wave, this interplay and interface of mental health has already been going up. Let's not forget 1 in 5 people in the world suffer from a mental ailment in any case. So the mental health epidemic was already there. And what now it's happened is that one, you have mental health illnesses, which are diseases, and now you have distress, which may not be a disease, but requires some kind of support and intervention. And that's the kind of ecosystem that we are now in, sir.
Thank you very much, Samir, for putting it so eloquently and taking us through all the aspects, both for the healthcare professional as well as for public at large. And you rightly said that it was more than just the infection. It had so many aspects, and that's why probably the Lancet called it a syndemic. Also the fact that so many non-communicable diseases, those who had it did much worse. So it was not just the infection itself, but the host also, and the ailments or chronic illnesses that they had, which played a role in the ultimate, getting better or, losing out in the battle against COVID. You've talked about telemedicine, and let me take that to Dr. Bagai. Sanjeev, as you know, in March itself, actually, I think the government was very, very proactive. Apart from the fact that they had the lockdown, which has saved innumerable lives, and mathematicians make all kinds of judgments and calculations, but the fact is that many lives have been saved. What they also did very quickly is brought out rules and act for telemedicine, which we've been talking about for 20 years in this country, which in minuscule measure was even being practiced, but which was actually illegal. It was actually surprising, shocking for many of us to know that, if you give a prescription over the phone or on email, it was illegal in this country. So what do you think about telemedicine, its use in India, its how it helped during the pandemic, and what do you see as the future? Because there are a lot of young people here When we were young, we used to have a GP in the colony, and you would go to Dr. Uncle and he would take care and he knew everything about you. That breed is gone. And so can telemedicine be the stopgap or the permanent arrangement in the years to come? Of course, as has been said by Sameer, access it gives you. There's no doubt.
Yeah,
Sanjeev.
yeah. Thanks, Harsh. So I think technology, which includes telemedicine and other applications, including AI, are actually going to leapfrog us into the next generation. They will never remove the human element of doctors, but they will bridge a gap which was a much needed bridge to be covered. A lot of patients are actually in inaccessible areas. A lot of patients are disabled, handicapped, single people who cannot actually reach out to a hospital setting for each and every query. So I think one is, of course, it brings face to face a patient to a doctor, even if it is for a few minutes consultation. It helps a patient mentally, psychologically, that the person has had a word with the doctor. You can at least briefly chalk out what needs to be done. There are riders to it. That means you need to give a formal guidance. It can't be just a verbal communication. It's better for a patient's point of view that you give a appropriate guidance, preferably then transferred either through WhatsApp or an email. So of course you need a back office support for it. But I think it's extremely important, especially in emergency situations, patients who are even in inaccessible areas, in ERs where they don't have specialists. I think it helps hugely in radiology, in imaging, because a lot of people have the machines there, may not be of the type of grades which luckily we are in a fortunate position to have in Delhi, like in your centers, but they don't have the radiologists, they don't have the manpower behind, especially at late hours. So I think it helps greatly there. International data shows that it's a 68% increase in telemedicine worldwide. And I think it's here to stay. And it's better that all the doctors embrace it. It's important to keep a record, you yourself as doctors, of which consultation you had with patients, not only from a medical legal angle point of view, but for a continuity of care point of view. And I think it's important that patients should realize which consultations can be on an e-platform and which will necessitate a personal visit. So I think it's an important step forward, and we should embrace it, but be careful in using it and not overuse it. Use it judiciously.
Thank you. Let me ask another question on testing, because that is something which everyone wants to know. RT-PCR, like you said, this country was capable of only 100 tests a day when we started. And today, we can go up to 2 million tests a day. That's how, both the public and the private sector has responded to the need that was there. And as in most other instances, about 70-75% was the private sector. Now, the other word that we learned, and you must, may I request you to tell us what is RT-PCR showing? Then we have the antibody testing, which, especially after vaccination, people ask, should I get an antibody test done? And then finally, about genomics and what are these mutations? You've spoken extensively about it in media. So why don't we enlighten our audience as to the exact place where these tests are in, and what is the use and where to use it, where not to use it?
Thanks, Harsh. Is that question for me, Harsh?
Yes, that's for you, Sanjeev.
Okay, thanks. So quickly, there are three parts to your question. So without wasting any time, I think RT-PCR test should be done judiciously timed. If it is done too early, the viral load in the body is at a lower ebb, and you may not pick it up if you are asymptomatic completely or pre or post-symptomatic. So probably the best pickup is between day 3 to day 5 of the illness. There is no point in repeating the RT-PCRs recurrently again and again. There are modifications to it known as NAT, which is also now being done through the saliva. The routine RT-PCR done worldwide is through the nasal swab and through the oropharyngeal swab. The full form of RT-PCR is real-time polymerase chain reaction, which actually picks up the protein, but of the virus as an antigen, but it does not tell you whether it's a replicating virus or not. So it will tell you what we call as a CT value. There are lots of studies to show the formation and the graph of CT value versus severity. We won't go into those details, but it has its limitations too. In best of times, it has a sensitivity. That means to pick up the positive cases between 67 and 83%. Now, with regards to the antibodies are perhaps the most widely used term in all families. And in fact, sometimes you are questioned, why did you not get the antibody test done? As if like, you're not that intelligent enough, why didn't you know it? So to put the mind at ease of everyone, I don't want people to be rushing for antibody tests either after an infection or after a vaccination, be it the first shot or the second shot. The limitation of the antibodies are that most of the time they actually capture what we call it the surrogate antibodies. So we now know through a lot of research in the last year and a half, that COVID is not fought back only through what we call as the magical word as neutralizing antibodies. So the neutralizing antibodies again are of different types itself. It attacks only the receptor binding protein and non-receptor binding sites. We also know that there are non-neutralizing antibodies too. We also know there are antibodies to the N-terminal domain. There are different parts of the protein where antibodies act. And best of all, the magical word is the T cells are more important now than the antibodies. So I want people to be at rest. Don't rush in unless until you are actually advised on medical grounds to go and get it done.
So that's a very important point, Sanjeev, that you don't need to get antibody test done post-vaccination unless there is specific reason for getting it done, and your doctor will tell you. Don't rush to a lab and say, "Mera antibody check kar do."
Correct.
So that's a very important point. And now about the genomic testing and the could you throw some light on that?
Okay, so that's my.
And then we'll go to Balbir. I see he's there.
Hi, Balbir. Good to see you. He is my. He and my another friend Rohit and PP Singh are my oldest friends when I started practice. We started practice together in Batra. Okay, so genomic. It's my pet subject. So all viruses mutate. RNA viruses also mutate. This particular virus has a habit of mutating 11 once every 11 and a half days. Worldwide, we've had more than about 11,700 mutations. In India itself, we have more than about 1,400 different genomic sequencing types and phenotypes which we have seen. So a virus protein, when it is laid down as a strip in a laboratory, it has different parts. So it goes as a base pair of 30,000 base pair, but the amino acids which go as building blocks, they go as jugalbandi, so to say. So it goes as ATGC, it goes as dual pairs of amino acid building blocks, what we call in a protein sequence. And there are 1,273 base pairs in this.
I think that's becoming very, very technical, Sanjeev. Tell me, has India done enough of genomic sequencing?
So the most important part is the mid part, the 400 to the 500 part, what we call as the receptor binding protein. So most of the mutations, either substitutions or deletions, happen in those areas. Why it is important to pick up from genomic sequencing is, say, a mutation like which has taken place of Delta. Now, what that Delta has actually proven is it has 17 different types of mutations, and it makes the virus behave differently. The character of the virus is different. It becomes more invasive. It fuses into the cells more quickly. So to answer your last part of your question of have we done enough of genomic sequencing, the answer is no. In the last 2 months, a place like UK has done 1.8 million genomic sequencing. Probably India has done about 25 or 30 or maybe 35,000 so far. So we need a lot more genomic sequencing and in a randomized way so that we can capture a larger spectrum of the society to see where these mutations are taking place. Over to you, Harsh.
Thank you, Sanjeev, and welcome, Balbir. Sorry we are pulling you away. I hope your patient's doing well.
Yeah, thank you, Harsh.
Yeah, now we've seen, initially we thought that this is just a respiratory virus and that's what it is. But as we learned, we realized that it's causing, blood clots, it's causing other problems, the heart is getting affected. Now, what has been your experience since, you run a very active practice and your hospital also was a designated COVID hospital? What has been your experience and what would you like to tell, because we are looking at how to prevent things in the future. So we have a large number of youngsters as well as elderly hearing. What have you found in these months and what would you advise them?
Yeah, thank you, Harsh. So first of all, Amod and I are schoolmates, same class, and Harsh was our 1 year senior in DPS Mathura Road. So Harsh, we remember him as a Bonvita quiz champion and a great TT player, apart from being a brilliant student. So Harsh went to MAMC and I followed him. So I was 1 year junior to him in MAMC. And Sanjeev has been a great friend right from my practice days. And now Romal Tikku is a colleague at Max Hospital. So I have friends all over. Of course, Dr. Samir Parikh, everybody knows. So this virus has actually baffled us. So I will be very honest that all the prediction that I made or any of the pundits who made on the TV, even the top pundits who came on the TV, whether it was international or national, were all proven wrong. First of all, when this virus was in China, we said, SARS and MERS came and they never came to India. We thought it will not come to India. That was the first thought that came to us when it was in January, February of last year. Then when it came, we said, we are so hot a country. This has been in Beijing. This has been in New York. This has been in Italy. India, this virus will be finished. We were proved wrong again. Then when the virus was kind of contained in our country, we had a minor first wave. We never thought the second wave will come. I see that even the health minister came and said that we have won the battle, but we had never won the battle. So we were baffled again. Now the pundits are saying the third wave will come, which I'm not sure if it will ever come or not come, because nobody can predict anything. This is virus. Now, second thing this happened in this virus was everybody said this will produce pneumonias or mild cold illness like the others virus do. This did all disasters that one could possibly think of. Today we have a 35-year-old boy admitted who had COVID last month and he stayed at home. He had mild illness. Now he came with tachycardia. His heart rate is fast. We did an echo which showed an ejection fraction 35 to 40%. And Harsh would agree with me that MRI studies have shown that 2/3 of the patient will have some kind of myocardial involvement. Whether they produce any symptoms or not is a different story. So that this virus does so many bad things. It is something we never imagined, never thought. And the cardiac patients have been very badly suffering because we have had a lot of heart attacks happening in COVID patients. We have had heart attacks in patients who have taken COVID vaccines because they increase thrombogenicity. And the worst was when the COVID was at its peak, the cardiologist would shy away to do a primary angioplasty in a patient who's had a heart attack with COVID. So they face difficulty. COVID patients face difficulty not only because of COVID, but also the concurrent non-COVID heart illnesses or other illnesses that were there. So it has been a disaster all over right from the beginning. And I don't see that we can ever see this kind of a situation again, or we never saw this situation again. Spanish flu happened 100 years ago back, but I'm sure it wasn't that bad. Of course, the travel was much less. The population was smaller. There was more open areas, so they may have prevented that. But this kind of viral behavior is unheard of, not seen. From the virus point of view, it has all the properties which can make it a disaster. It doesn't kill everybody. It kills only a minority of people. It can cause mild to severe illness in many, spreads fast, varies fast, mutates fast. So from its point of view, it is the worst thing to have. So I feel that we have to avoid the disaster of a third wave, because a third wave is a very deadly thing if it happens. I just hope, I would say that one should be optimist and pessimist both. Pessimist that it is coming, so we take all the precautions, vaccinate, take all the precautions, and be optimistic that it won't come. So, and be confident that we'll win over this battle. So I am baffled with this virus for sure.
Thank you. Thank you for being so outspoken about it and also emotional. I mean, all of us get emotional because we've seen countless patients who've suffered, who've died, and some who've not died are not doing so well. So, Romal, coming to you, as Balbir has said, the heart is involved. Do you feel we are heading, and these are coming after people have recovered, these are coming even in those who had asymptomatic disease or mild disease, and then you see 2 months down the line or 3 months down the line they start having tachycardia or other rhythm abnormalities. People have even dropped dead, whether due to COVID or something else, since in this disease one doesn't actually do postmortem, so one may never know. But one, what do you think? Are we going to have an epidemic of cardiac disease which is related to COVID? Because we do know that a huge number of people may have been asymptomatic and have never been counted in those nearly 2.8, 2.9 crore who were infected. And number two, this is also affecting the brain. We talk to people who say they have some cognitive abnormalities, the so called brain fog, which is continuing for months later. So, what is your take on this? And what can anyone who's had this do so that they are able to recognize the signs early and come to a doctor for whatever therapy that may be needed?
See, how I look at it as you have acute complications, like Dr. Balbir said, you have cardiac complications. You can have a myocardial infarction or myocarditis or arrhythmias. It can happen to anybody who's had COVID. It doesn't necessarily have to be a moderate or severe disease. Even if you have asymptomatic disease or mild disease, you can still end up with complications of COVID. Or you can even have long COVID. We have enough data to say that even if you had very mild disease, you can still end up with long COVID symptoms. Now, coming to the acute complications, yes, cardiac complications for sure. It's not happening to every other person. But yes, we do see every day 3-4 patients coming to the hospital getting admitted. I had one patient recently who was still in the hospital, had a very mild disease, 60-year-old, and had very low ejection fraction. In fact, he did the echo in your center. He called me from there. I had to speak to the doctor there, and he said, he's in failure. Admit him. So he was in congestive cardiac failure, almost died the next day, but he still made it. So there are so many of them like that. And then there are the neurological complications, meningitis, meningoencephalitis, stroke, seizure. And as you said, brain fog and all these are long COVID symptoms. Almost cognitive changes are happening to almost everybody, especially 60 and above. And then there's the deep vein thrombosis, those clots, then central venous thrombosis, pulmonary embolism. I had one Australian patient who had asymptomatic disease, ended up with bilateral DVT pulmonary embolism and hardly had any symptoms, just a swelling of the leg. And we do come across such patients every other day. And long COVID, that is a nightmare. I tell you, half the patients who come to the OPD today are of long COVID. Almost everybody has fatigue. 70% have fatigue, dry cough, breathlessness, tachycardia, palpitations, insomnia, not able to eat, the taste sensation is gone, and anxiety, depression, post-traumatic stress disorder. Most of them have it. So what do? I mean, you have to counsel them, reassure them. Pulmonary rehab. Half of them are ending up with oxygen at home also. They've had fibrosis of the lungs. They don't know how to deal with it, how to use an oxygen cylinder. How long do we use it? Day, night, BiPAP machines. This is a novel concept for patients. They've never done it in the past. But yes, we are seeing so many of them coming up with something GI symptoms. A lot of patients are having diarrhea, chronic abdominal pain, appetite is not there. And it's affected almost every system in the body. It's not only the heart, the brain, almost everything. And now, how do we deal with it? We have to tell the patients, even post-discharge or post a mild illness, once they've recovered, maybe 2 weeks down the line, they still have to keep monitoring their vitals. They have to keep a check on the oxygen levels. And especially if you have symptoms like excessive breathlessness on minimal exertion, chest pain, please do get in touch with your physician or a cardiologist. Maybe you need an ECG, maybe you need an echo. It also depends on your comorbidities, your family history, whether you're a smoker, not a smoker, whether you drink too much of alcohol, whether you don't do that, what is your age. I mean, there's so many factors. It's not that one size fits all. But yes, you need to be aware. You need to know what you're supposed to do. So post-discharge, don't just start hitting the gym 2 to 4 weeks. The majority of the young patients ask me, can I exercise? I'm not used to staying at home. Can I go to the gym? It's not done. As you just recovered from a dreadful disease, you should be thankful that you've recovered well. And most of them don't even need hospitalization. So keep a track of your vitals, get in touch with your doctors, do maintain a healthy lifestyle, eat well, rest enough, work from home as much as you can, sleep for at least 8 hours, do some breathing exercises, do yoga, do meditation. There's no specific treatment for long COVID symptoms. There's nothing we can do. Yes, for acute complications, especially if you have comorbidities like diabetes, heart disease, heart failure, things like, you can be on statins, you can be on anticoagulants, you can be on blood thinners, and so many things. And now what we are seeing also is that after recovery, 2 weeks, 3 weeks down the line, a lot of patients are coming back with unexplained fever, very high fever, as if they've had COVID the second time.
That happened really in the second wave. Didn't happen in the first wave.
We
where
had
if you
not
went
seen it
home,
in the first wave.
Yeah.
Now, high CRP, again, the CRP has gone to 200, but the lung status remains the same. I mean, do you give steroids? Do you not give steroids? What do you do?
This Delta variant has really caused significant problems. And, that's the difference between the first wave, which was with the Wuhan virus, and the second wave, which has been a mixture really of the Alpha and the Delta, more the Delta in the latter part. So let me move now to Sameer. Sameer, we have lot of apprehensive people who have recovered from COVID, who had mild disease, and they are now recovered. They are asymptomatic. They have no problem. But they are so apprehensive that something may happen. They heard someone had a heart attack who was young, and they are scared. And then there are genuinely these long COVID cases who are going through, a lot of psychological, of course, they have medical problems, but on top of that, they have psychological problems. What is your advice for these people? And then also for those, especially the students who've sat at home, the colleges have been closed, and, many gained weight, many went into depression, just sitting at home, not being able to meet friends. So, how do you actually tackle this? What do you advise them?
I'll split this in two parts. The first part, which is more, let's say, clinical, what I have been doing, I can tell you. So when I see patients who come post-COVID and they are talking about any of the symptoms that either Dr. Singh or Romil talked about, fatigue, fog, insomnia, frankly, I am not medicating them right now. Right? I would probably use an occasional benzodiazepine or a zolpidem, maybe, if the insomnia is very significant, but I'm not rushing into a treatment. What I tell them is that what you are having is that you've gone through an acute stress. This is a human reaction. So just as an example, I'm saying, like how we used to old school talk about bereavement, that, you've lost a loved one. So if you go through mood swings, you go through sleep issues, you go through changes, give yourself a couple of weeks. Old school used to talk about 8 weeks after, that you don't, before the changes in diagnosis happen. Old school was that if in first 2 months don't diagnose depression, even if depressive symptoms are there. That's now not the case, it's a separate issue. So what I am doing is I'm using a lot more of supportive reassurance, encouraging people to stay in touch with their primary physicians, and going at life gradually, where you focus a lot more on the mental wellness component, which means talk to people, spend time with people, do things you like doing, get that positivity also coming into you. And thereafter, you can gradually start going back with your work based on the nature and the kind of work that you have. And yes, for all those who can do work from home, to do work from home. And like Romil said, this is not a time that you go rush into a gym. There is no hurry. The doles can wait for a few weeks and months. It won't change a difference. Your selfies will not be spoiled. right? So, so that's as far as that is concerned. But at the same time, if we feel, and especially when you have the geriatric population, I am very wary of giving meds, because what happens is it's very easy to say, okay, this is an anxiety, this is a depressive phase, let's give an SSRI, but then SSRI gives a hyponatremia. There's already something else happening that we are not aware of. And like I'm hearing all of you, and I feel that a lot more, that's why a lot more conservative approach is required, because if there is something happening internally and it may surface in a few weeks, then we should be a bit more conservative and go step by step. And it's really worked. I have seen that, probably more than 50 to 60% of patients in their follow-up would be about 30, 40% better, already saying that, okay, I think I can manage without meds. So that reassurance, telling them that everybody is in a similar boat, this is not something alarming. Let's not rush into a psych med treatment protocol, because at the end of the day, if I diagnose you with depression, I will give you meds for not less than 6 months. I need to be absolutely spot on sure that this is just not a reaction. So I think that's the clinical side.
So, if I understood it correct, because people self-medicate also. So the message to them is medication as little as possible, and that too only after you've consulted a doctor. And people are better off without medications, especially in the elderly age group, because there are so many interactions happening, and you may end up harming rather than helping. And now on to the other group, these people, especially the youngsters who are sitting at home, not able to meet, not able to party, and what do they do?
I'll tell you what I've been telling students. In fact, 5 p.m. I had an internship that we've been taking, and couple of thoughts. One, when it comes to school students, I've been telling them at most levels on a lighter note, and there's no harm smiling at in adversities also. This was your dream come true, isn't it? I mean, taking your first class from your bed in a pajama, with your screen off and your teacher not knowing whether you are asleep or not. I mean, we never got that, did we? So, and then teachers would smart up and they say, switch on this mobile. And then, there's a game happening, sudden roll call happening and not roll call happening. And a friend is giving us this thing. So all sorts of things have happened. In my opinion, students, especially young population, has handled the COVID experience very, very well, sir. All said and done, I know a lot of people have talked about young people, but I think they have been, way better than all of us. I think they've responded to online training very well. I think they've responded also probably because young people are a lot more digital savvy. They in any case had a digital presence. It was easier for them to convert into more digital interface with their friends as compared to people like us. It took me several months. And even now, as most of you know, that all of us still had to do a dry run yesterday, right? We still needed to do a dry run because all of us, and Romil is the only young person here, right? Had
no,
to
Sanjeev is very young, yeah. Sanjeev is also very young.
Dr. Bagai will be young forever. So that's a separate issue altogether. But the thing is, let's say, but I also feel, sir, this has been a different kind of an opportunity. I'll give you an example. I'm a healthcare practitioner from the field of mental health. I've had so many non-mental health students coming to me in the last year, people who are doing marketing, people who are doing management, and have come to learn healthcare communication. That because digital interface is happening so much, the fine art of communication in healthcare, doing a simple social media campaign from a healthcare point of view. And not only that, we are giving internship for school students, we're giving internship for now college students, of course, budding psychologists, and have now non-mental health specialties also coming up. If you'll go to LinkedIn of young people, you'll see every now and then there is a certificate popping up, right? So they have been aware, they've tried to utilize this time. And my only advice to them has been, you're all in the same boat. So whatever exam that is, earlier it was 12, now it could be a NEET or whatever else we are discussing about. We're all in the same boat. Nobody has an advantage over somebody else. When the exam happens is not in your control. What happens about the exam is not in your control. Keep studying, and party is not merely actually going physically to a place and making a fool of yourself. You can equally make a fool of yourself on the digital interface also. You know, some of your status updates and some of your DPs are embarrassing enough to keep reminding me that it doesn't take much to bring out the child in us.
Thank you, Sameer. Those are fantastic insights, and I'm sure all the youngsters who are here would take heart from what you're telling. And let me go to Balbir now. Balbir, what is your advice to people as regards your specialty, the lungs, the heart? What should they be aware of? When should they contact a doctor? Because, you know, we are trying that because there may be so many asymptomatic who never got tested, who never knew, and they suddenly come up with something. So, and when it's a matter of the heart, whether you give it to someone or it starts beating too fast, you know, oh, मौत तो लिखी है. So, आप बताइए, what do you advise these people and youngsters included, because we are seeing a lot of youngsters getting affected?
Right. So it's a very important question, because the COVID doesn't end with the COVID discharge from the hospital, or it doesn't end when the patient gets negative report. The process still continues. So I'll give two examples. One of a colleague of mine who is 5 years younger to me, had COVID, which is moderate to severe. He was admitted, he was on steroid. And a month back, he called me up that he's fine and joined back and was feeling great about it, and doing normal work in the hospital, 8 hours every day. And last Monday, I got a message from his hospital that he dropped dead during sleep. He had no cardiac illness in the past. He had no normal ECG, and no reason that we could have seen. The other patient was another 40 years old. His only complaint was his heart rate all persistently above 100. And that's all he came with, and feeling of fatigue and unwellness. That's all he came with. Again, last week, COVID 1 month back, we worked him up. Echo was normal, ECG was normal. I did an angio because he had a strong family history, which did show only mild disease. But that patient persisted that he has some problem. We got a CT pulmonary angio and found there was a pulmonary embolism. So, you know, it baffles me also to what extent should we investigate everybody? Should we get CTPA in all? Should we just monitor the heart rate? Heart rate is a very important parameter. So if a patient comes to me continuously saying his heart rate is not settling, which many of them are coming and telling us, because they are monitoring their saturations continuously. So they know their heart rate is not settling. At rest, it is 110, 120. And that is the time that you should investigate further, because these clots are very dangerous. And getting one CT pulmonary angio gives so much information. At least gives me the relief that I'm not making a mistake in the diagnosis. Because if I make a mistake, it's a disaster, because I know the next thing will be a sudden death. So don't give up. If you had COVID, even if it's mild, go to your doctor, let your physician evaluate you. Those heart rates going to 100. Before COVID, we used to tell the patient it's anxiety, just relax. Now we are ourselves worried that is it a clot which has gone to the heart of the brain or the lung, which could potentially cause him a death. And so please don't take it lightly. You must contact your physician. He may be picking up some subtle symptoms, and an investigation at time may save many lives.
Thank you, Balbir. And Sanjeev, vaccination. You know, we are saying, how do we prevent getting infected if the third wave comes? What is your take on it? What should we as individuals do to save ourselves? And what is it that the government can do to help prevent the third wave? Because everyone now is talking about the third wave. Please unmute yourself.
Yeah. So irrespective of the number of surges which will continue to come, I think there are three important messages. One is stay home as much as possible, go out only if it's required. Point number 2 is not mask, but a double mask. That is extremely important. Don't forget indoor transmission. Don't forget airborne transmission. We won't go into the details of it, but we know that this can have a household transmission. Protect the children, because children can be an equally lethal carrier of infection, and get yourself vaccinated. I think it's our moral responsibility to our nation to become vaccine ambassadors. Whichever vaccine is available, the first one available when you're registered and your turn comes, please take it. Don't go into the medical details of which one is better. Don't go into the pros and cons. Do not worry about the side effects. Do not worry about the reinfection rates. The ICMR data is extremely promising. The reinfection rate is 0.03%, which is minuscule. The side effects in the Indian scenario diaspora are extremely rare. They are safe. They save lives. Masks prevent infections, prevent transmission of infections, protect your elderlies, look after your comorbids. Health is neither a state subject, neither a central subject. I think health is your individual subject. I think you have to take control of your own life now, and you got to look after the community. You got to look after the society, because if they are weak and if they are ill, you may be the best person on earth sitting in your home, but at some point in time, you're going to get infected. So I think the world truly has been flattened. We need to work together in cohesion with the government. No criticism, no vaccine hesitancy. We all need to work together.
Thank you, Sanjeev. So the important message here is that take any vaccine that is available when your turn comes, because all vaccines that have been cleared by the government are good. They will save you from infection. They will save you from serious illness. And if you just get a cold even after vaccination and it doesn't require hospitalization, that is what the vaccine is meant for. Now, Dr. Tiku, what is your take on how to prevent getting infected? And, is the Delta wave and the Delta plus that is on the anvil? We already have 60, 70 cases in India, and that we picked up despite the limited number of genomic sequencing that we are doing. So the number may be much larger. So, what is your take on these variants, and how do people save themselves?
See, we've seen what the Delta variants can do. To prevent yourself from getting infected with these variants, first of all, you have to stop from getting infected. And what do you do for that? As Dr. Bagai rightly said, work from home as much as possible and follow a COVID-appropriate behavior. Wear a double mask, avoid crowded places, and do get vaccinated. I would say we speak a lot has been discussed about the shortage of vaccines, the slow pace of the vaccination drive, the pricing, the distribution, the allocation, whatever, but we don't speak about vaccine hesitancy. There's a lot of vaccine hesitancy even now, not only in India, outside of India too. And this has the potential to derail our ambitious vaccination drive. And people do go by misinformation, fake news. There's so much of fake news out there on the social media platforms. And we have to do something about it. And I really think that we have to, again, raise awareness about the benefits of the vaccine. We have to rope in celebrities, have credible voices for the vaccine. And physicians, doctors also play a huge part in this. We have to take people into confidence and make them understand how important it is. Because there is about 30% vaccine hesitancy right now in India. And even so-called educated people, even a lot of healthcare professionals are hesitant at times to take the jab, which is not done. But vaccine is the key. Vaccination is the key. This will pull us through. See, we talk about COVID-appropriate behavior. We talk about double masking, but how many people actually wear a mask properly? And what can you do about it? It's been 1.5, 2 years, day in and day out. We talk about wearing the mask properly, but once you go out, you see them even in the OPDs. Patients come in and start removing their mask. You can't do anything about it. So what you can do about is the vaccination. And now with these variants coming in, and we have enough real world data from UK, the Public Health England has analyzed it, studies from ICMR, that vaccines do work against the variants also. In fact, the Pfizer vaccine And the Moderna vaccines have about 88% efficacy against the Delta strain after 2 jabs. AstraZeneca has about 60%. And now the data from Covaxin has come out. A lot has been spoken about the efficacy, the safety. The people were of Covaxin, people were so skeptical about it. Every other day we would get a call. I don't want to take Covaxin. I want to take Covishield. Where do I get it? But now the data is out. In fact, it has 65% efficacy against the Delta strain. And it has a very good efficacy of 78% against symptomatic disease and 93% against severe disease. So practically,
Yeah, that's the point I would like to highlight. Thank you very much, Rommel. That, we are really scared about serious illness, hospitalization, death. And that's where all the vaccines that we have in our country, be it Covaxin, Covishield, or even Sputnik, all of them have 90% plus effectivity against serious disease. And that's huge. So the bottom line is vaccination. And the final word to Samir, how do we stay happy during these times? You are the boss of the brain and the mind, more than the brain. How do we still stay happy, stay focused, stay motivated during these troubled times? And after Samir, it's over to Dr. Bansal and Amod. You're muted, Samir.
So before I say that, just one thought that came to my mind, and I want to say this because there's a lot of, you guys are all big names of the healthcare industry. I think healthcare providers, healthcare workers, doctors need to become opinion leaders in the digital interface as soon as they can. Yes, we've been hit by the wave and we had to fight it, but we need the likes of you, sir, Romil, everybody, Dr. Bagai, Dr. Singh, your organizations to have such an active social media presence that no fake news and non-credible sources should not be able to derail medical education, because that's the problem that we are facing now, and it will be a lot more in years to come, because somehow we as medical practitioners have not taken up to digital information the way we should have, and this should be an eye-opener for us as times change. And I strongly believe all of us need to have a very strong social media presence. That's the one way we'll be able to change, because it's not just an epidemic, there's an infodemic also happening here. And information needs to beat stupidity. Having said that, we have to find our own happinesses. I mean, the saddest thing that I remember over the last few years has been the need to have a happiness curriculum in schools. What kind of a society reaches a level where you need to teach how children should be happy? Shame on us, right? Where in a different country has a happiness minister, some other country has a loneliness minister. These are eye-openers. I mean, come on. Imagine the government coming and telling you, talk to your friend.
We can send our people from here, yeah, for loneliness.
Imagine the government telling you, "Aaj aap hanse nahi ho ji," right? Or the government coming and telling you, "कि आपने पौधों में पानी नहीं डाला है." Be very clear. What makes you happy? Happiness is about people. Today we've realized the importance of people. It's not about followers. It's about people. The true relationships. Spend time with people who matter. Invest time in your own selves. Take some me time out. Families will bring happiness. Your valuing your own self will bring happiness. Every now and then life will test us. COVID is a horrendous test, but we are still standing. So cherish that, respect that, and then spread that positivity. It's very easy to spread a negative message, very easy to abuse, very easy to troll, has no purpose except spreading negativity in the environment. All you have to do is continue to spread positive stories, and it's okay, even in difficult times, find a bit of a laugh here and there. Take time out for yourself, and we should be taking ourselves too seriously. We aren't that important, actually,
So on that note, we are not so important actually. which is true. We are important only to ourselves, maybe, but I don't know. On that note, thank you all very much. And Dr. Bansal, I've tried to cover as many questions as were possible during these last an hour and 20 minutes. And now it's over to you, sir. Thank you very much.
Yeah, no, thank you. Thank you, Dr. Harsh. And each one of you has been just fantastic. But Dr. Harsh has not been asked any questions. So I'll request both Romel and Samir, and I'm sure by that time Balbir will come back also. You please, because his area of expertise, his contribution to the success of, to be honest, each one of you, contribution of his and his field has been just tremendous, humongous. And I'm so happy that he's still, all of you, one thing I must appreciate and tell all the students, all the academia, and I would say all the 501 participants right now is just keep smiling like all of them are. Please understand the kind of mental tension, the torture, the agony, the harassment, disbelief even into them own selves they have undergone for the last 16 months. And you see how happy, how smiling, how positive they are in life. So unless you are that, you would just collapse. Unless you are that, you may call it COVID or you may not call it COVID, you are going to be hurt. So just be very positive. Life, you are very lucky people. You're sitting home enjoying all this, and one has survived all these waves. So God will be very kind to you, as told by them. Just have your vaccination and go back to your campuses, go back to your schools. Okay, that is of course for the government to decide, and they would decide on the doctor's recommendations or the protocols given by the various state governments of the WHO. But I can only presume and see that future is very bright, because all those people who come out of difficult situations, they come out to be more strong and more healthy and more tough. So I'll now give it to Samir and then to Romel. Please ask questions to Harsh about his contribution, his learning, what has happened in the last 16 months, and what has he has to advise all of us.
I'll go first, right? So I'm hardly a doctor when it comes to medical aspects, right? I mean, even today, to be honest, if I would have had a sore throat right now, immediately next I would have called Romil that yaar wo gale mein kharaj mein karna kya hai.
That's the thing to do. No self-medication.
Not at all, sir. I genuinely, and Romil knows this, I genuinely would not even pop in a paracetamol because I don't know that science. I mean, I have done MBBS in long history, which is long forgotten, and with the blessing of the teachers who just barely passed me. So my question to you is, I think role models like yourself, there is so much to learn from experiences of your life, right? So I want you to tell the people who are listening and who will continue to listen to this, you've been at the forefront. You would have gone through the kind of pressures of a test now, a result now, and a barrage of overcapacity and so on and so forth, day in and day out. How does an individual like you deal with your pressure that young people can learn from?
Thank you, Samir, for very, very kind words, which I don't deserve. But somehow, ability to take pressure is also an innate gift given by God, at least in my case. If you have a positive attitude, even when things are going wrong, I at least, am able to see some silver lining somewhere and be able to see more of that than the negativity. And in my own life, I found that when things were not going right, that is when, you were challenged to think differently or do something differently, which actually led to further success or doing something different. what I would like to tell the youngsters, and this has nothing to do with medicine or healthcare, is that we set goals for ourselves. When we were in school, I wanted to be a doctor, became a doctor. Then after that, I wanted to do MD medicine, like what Dr. Rommel Tikku did. And somewhere my second choice was radiology. And, you know, in those days at PGI Chandigarh, there used to be a separate entrance exam for every subject. There was no common entrance test. So when I went, I wrote one entrance exam for medicine and I wrote one for radiology. And there were 2 seats in medicine and 2 in radiology. In fact, this is also a story which I'll share. So I wrote the exam and there was no doubt my first choice was medicine. And the next day, there used to be no list put up, you know. You were called to the conference room and there would be 4 professors sitting on the stage, and if you qualified, your name was called. And my name was called and I went up to the stage and they told me that you're first on waiting list in medicine and you're first in radiology. Now choose. And radiology today and radiology of that, I don't even know what got into my head that I even wrote the exam for radiology. And they gave me about 3 or 4 seconds to choose. Now I can say I chose the right because you know, if I had got medicine, my career path would have been entirely different. And the person who got in, and because he took the seat and I did not get it because I was first on waiting list, is today the director of All India Institute, Randeep, Dr. Randeep Guleria. So every time I meet him, I hug him and thank him that if you had not come that day, I would have done medicine and not done radiology. So, and I can tell you, I was not happy. And for the first month in radiology, I was extremely unhappy because they post you in PGI into the dark room. And there, between a darkroom assistant and a technician and a technical student and a you know, MD radiology student, you can't make out in the darkroom. Those were the darkroom days. But then this is what. So my, you know, learning has been that whatever hand God deals you, He knows better than you with your limited intellect, with your limited ambition. So what you have to do is make the best of the opportunity. Do your very best, irrespective of what field you're in. And, you know, God will chart out the path for you. And also try to look, it's very easy to say now, try to look at the positives rather than wallow in the negativity of failure or of not having got what you wanted, not the specialty that you wanted or the area of where you wanted to work in. And the same goes for my becoming an entrepreneur. I'll take 30 seconds more. I mean, my parents were teachers. We were, I mean, middle class. And to think of setting up a MRI was just beyond me. And this I'm talking late 80s, when even doctors used to call it MIR. You know, and I came back after my fellowship in the US in MRI to do a job here. And India's first MRI had got installed at INMAS, the DRDO lab near the Delhi University. It took 2 years for a vacant position to be advertised, for the interview to be held, and for me to join. And during that time, I thought, I'm the only trained MRI person in the country. And, you know, I'm going to forget everything. That's how the seed of even trying to do it. And at home, they said, Pagal ho gaya, karodon ki baatein karne lag gaya. But we found a partner, we started, and we actually set up a MRI 2 years before All India Institute got its MRI. So this is how God knows much better for you what track your life should take than what you can ever fathom. And I'll conclude by saying that if God had given me, when I was 30 years old, a blank piece of paper and a pen and said, Beta apni kismat likh le, there's no way I could have written where he's brought us. And that may go for any person who's done well in life. So the answer to your question, and Rommel won't get time to ask one, thank God. You would ask a technical one. The answer to your question is be positive in thinking. The dark will always have a light at the end of it. And unless there are storms, the crop that you get is never going to be as healthy. And the fruit that you have, or Punjabi mein kanak kehte hain hum, jo banti hai, the wheat will never be as good unless it has gone through storm and sunshine. So take life as it comes, always be positive, and this COVID will go, but the onus is on each one of us to not get infected. And that can only happen if we vaccinate and follow COVID appropriate behavior, because the mask and a double mask will prevent any kind of infection, no matter what be the mutation. So thank you very much. I think we
Fantastic.
overshot.
No, you have done fantastic, and all of us, you rightly said, have maybe similar stories that whatever you ever imagined, rather we never dreamt or imagined where God has taken us. That's been just a fantastic journey. And would Rommel and Balbir also ask some question to Harsh before we let everybody go? Because he has been grilling you for the last 80 minutes.
No, I was so benevolent.
Yeah.
I only asked what they knew. मैंने course के question पूछे.
Dr. Balbir, you ask first, then I'll ask you.
Harsh, what do you think? I'm going to ask you a question which is very provocative, because the Pandit saying that the Pandit you just mentioned took the medicine assessment, just said that the third wave is coming in July or August. What is your take on that? And it will be even more severe than the second wave.
Yeah.
So what is your prediction? Because I've seen people predict different things differently.
See, I think we would be gods if we could predict what is going to happen, when the wave is going to come, when and how severe it will be, whether it will be worse than the second or not. A lot of people, mathematicians, scientists have done mathematical calculations and come up with different answers which are all over the place. But I think what Dr. Guleria said was said in a context. It was said when for 2-3 days we were seeing on television absolutely COVID inappropriate behavior, where the markets were full, the masks were down the chin. These are more chin masks than anything. And so I think sometimes one has to jolt the public into coming into appropriate behavior. Because what he said may even be possible. If we are continuing this kind of behavior, that wave may come in 6 to 8 weeks, as he said, and it may end up being more severe because now the virus keeps mutating. God knows what kind of virus we will have. And more the number of people infected, the higher the chance of mutations, and one of them may become a variant of concern. So I think that was said to jolt people into following COVID appropriate behavior. No one knows how large the next wave will be. There will be a wave, there's no doubt. In fact, someone said very appropriately that when we say wave came, wave stopped, and wave went away, The second wave hasn't gone. We still are having an average of 45,000 infections a day. So, we are talking of the third wave while the second wave is still very much around. And so I'll quote here a very famous mathematician who lived and worked in London, George Box, and we lost him, I think, in 2005. And he said very appropriately, all mathematical models are wrong. This is a guy who all his life made predictions and based on mathematical models. He said all mathematical models are wrong, but some are useful. So this is what I think Dr. Guleria has done, that he's tried to jolt people into COVID appropriate behavior. And I do hope that that prediction of 6 to 8 weeks and it being worse than the third, it is within each one of us to see that that prediction does not come true. I'll say that.
I fully agree with you that we still need to tighten ourselves. We still need to be more careful than we ever have been. We have been jolted by the second wave. So one has to remember that we have a last opportunity to save ourselves. What happened in the second wave, if it is replicated, the country is destroyed because we lost so many friends and relatives. There is no business that we should be behaving like we did in, say, February or March, which really put things in such a bad perspective.
Absolutely. And people talk about government lockdowns. I've been talking about self-lockdown. You have control over yourself. And if you protect yourself, you're protecting your parents, your children, your family, your friends. So the onus rests equally on us as the government. Government can only do that much and not more. Yes, Rommel, I'm ready for you.
So the poor quality of healthcare services and infrastructure shortages in our country need to be addressed at the earliest. Otherwise, there will be a resurgence of these viruses, future pandemics also. I mean, the pandemic has exposed the immediate flaws of our healthcare system, and we need to understand the importance of its prioritization and long-term strengthening. So I think our healthcare system needs a massive overhaul. So what do you think should be done, and how can we as young, passionate doctors, what can we do or what the government can do to make it better? I mean, we need to have state-of-the-art modern hospitals with all the infrastructure. Now it's high time in India, and the government also has to. We are fortunate enough that we have a very strong government at the center, but it all depends on the political will and the leadership which we have. I mean, what does one do to make it better and prevent the future pandemic? It's not only the pandemic. We've handled the second wave, third wave. It can happen again 10 years down the line. If we continue to have the kind of infrastructure and the healthcare quality that we have, I mean, everyone is dependent on Apollo, Max, Fortis, Gangaram, and none of them would go to any other government hospital. That is the reality today. And will we go? We won't also go. So what does one do? How do we bridge this gap? I mean, it's a very difficult task.
Yeah, that's a great question to end the day on. And as you know, I'm also the president of the Healthcare Federation of India, NatHealth, which has members from the entire ecosystem of healthcare, all the large and many small hospital chains, diagnostics, all these manufacturers like GE, Siemens, Philips, Johnson Johnson, then home health. We have senior care, we have insurance, all of these. And we've been interacting with the government, and the government has been quite receptive. But do remember, we are still a poor country. And healthcare, even though it has come to the forefront of everyone's, vision, but still doctors are getting beaten up, and so, it's only in need that people think it's necessary and not otherwise. It has also not become a political, thing based on which someone will vote. If fantastic government hospitals are made in my city, will I vote for, say, the party that brought it? That still hasn't happened. And I hope that it does happen, because the politician only listens to those things that will get him votes. Of course, again, I'll say that the government has been talking with the private sector and trying to see how to increase capacities, how to not only in infrastructure, but also manpower. I mean, look at the shortage of doctors, nurses, other paramedics, technicians. It is here that one has to somehow, in our country, governments as well as people at large don't realize that for those high quality healthcare establishments costs money, and when it costs money, you have to pay money to be able to keep those institutions running. Here what happens, despite the fact that it is all free in the public sector, you don't go there. You come to the private hospital. Now, private hospital, I can tell you the EBITDA margins of most private hospital chains, the best ones, barely reach 2 figures. Which other industry do you have which will invest and keep running with so low margins? But yet we do. So unless people and governments realize that healthcare is expensive, unless proper costing studies are done, and maybe your college, Dr. Bansal, can do this, unless they realize that in the All India Institute or LNJP hospital or some other civil hospital, Sion hospital in Bombay, what is the cost of delivering care for COVID? No one knows. No one wants to know. It may be even more than what the Max Hospital or the Apollo Hospital or the Gangaram Hospital charges a patient.
It is.
Sir, no one agrees to that. So, because this is coming out of, a khata, which is the taxpayer's khata. And so no one wants to know that when I did a prostate surgery in a government hospital, what did it cost the government? They don't know. But they'll only say, oh, in a private hospital, they looted me. 3 lakh रुपए ले लिए, वहां तो ऑल इंडिया इंस्टीट्यूट में तो 5,000 में होता है. So this is where I have seen in the last few years that unless we are able to get our costing correct, unless the government, the public, and we know what is the cost of doing a procedure, we can never say that what you are wanting us to do, like say, Ayushman Bharat, let me take an example. For a gallbladder surgery, they pay 17,500. That's way below the cost of doing the procedure. And this is probably in a hospital which is both NABH accredited and also has DNB. 17,500. I mean, how can it happen? So, unless or else we come into outcome-based pricing. So that is where the problem is. Somehow in this country, we believe that we can provide quality healthcare at abysmally low cost, which is not true. We are still the lowest healthcare charges in the world. even if we compare with Pakistan, Bangladesh, Nepal, and Sri Lanka, our corporate hospitals are 20 to 25% cheaper for the same procedures, and I believe with higher quality, both of service and outcomes. But yet, if it's driven down, then private healthcare investment is going to shrink completely. I've not seen a new hospital being talked about in the last 2 years.
Yeah.
No one is even talking about it. Only those hospitals which were already under construction are reaching, completion and will start. But no one is talking about fresh investments. What you see about a Max or a Fortis or a Apollo is valuation. And that's where people will come in outside and buy a share and all that. But no one is talking about building greenfield hospitals. And that's going to be our problem. And this is where, unless public-private partnerships become viable, viability, not profitability. I don't even talk of profitability. Give viability. If that is there, and this is where all your students, I mean, you should take it up, sir, as a project
Certainly.
and do it.
No,
Because,
yeah, very right. No, we say the same thing, Dr. Harsh, because you studied at the PGI. Okay, what fee you gave, and at Maulana Azad, same thing. And we also studied at NITs and all of them. So now we discuss that the cost per student in the NITs or IITs or IIMs that the government bears, is just colossal. We know it, you're totally right. Now, before we end, you had one question for Amod.
yes,
Yeah, so you can go ahead
Amod,
with that question.
the media has played a huge role in this pandemic, and a very positive role. And we've seen that some of the media persons, the anchors, the writers, have become nearly doctors. They've researched so much, they've read so much, they've interacted so much with doctors. So, what is your take on this whole issue, and how do you think? Because I've read articles in our newspapers which are second to none in the world. They are so well researched. So, what do you feel about it, and how do you think we should keep this momentum going?
Absolutely, absolutely. Thank you very much. Thank you very much. And once again, meeting everybody, and it was such a fine discussion and some really constructive things coming out, so much information coming out. Yeah, you are right. Media has played a very important role, Harsh, and we also face challenges like the frontline workers, like the doctors did, because it was new for us also. And media was as much as a frontline worker and there have been numbers. Sadly, there have been numbers who didn't survive, covering the stories, being in the hinterland, being right there. One advantage that we had this time, or I'm still uncovering, is that the tools for dissemination of information, जो पुराने थे वो tools तो हैं ही हैं, but a lot of new things have added to it. For example, the current thing that we had for the last hour and a half, again, is a new, relatively new format where we do dissemination of information, the right information. And then we have the OTT platform, the over-the-top kind of a platform, and which won't even require internet, which won't even require another thing. But that is a platform and which is very much accessible, which is very much. And if we're talking about hinterland, if we're talking about the villages and all, I personally, who has about 100 hours, of, if not 1,000 hours of hardcore professional production, programming on different genres, including medicine and medical. So we've been dealing with NGOs, and we have been interacting with the state government and with the DGHS, that is General Health Services. And we've been not only just conducting workshop, but we've been right there in the villages doing nukkad nataks इनको और interesting बनाने के लिए, because you see the kind of multicultural and diverse that India is. You know, it's said that after every 50 kilometers, there's a change of dialect, there's a change of khana, थोड़ा कपड़े का भी फर्क पड़ जाता है, and most important, probably there could be a change of political party also. तो इन सब से deal करना, and a holistic kind of an approach which is being done, which is in operation, and be it by way of YouTube links, by way of OTT platforms, by way of conventional media, that is your TV and other things. And so that's how the media is kind of taken up this challenge and trying and doing its duty. Though much more needs to be done, as it is as new, these challenges are not really known to us. That we are as much new as the other fraternities are or the other groups are. So it is a kind of a learning process also. But one thing to our advantage that I'm seeing this time is that with the digitization and with these new tools that have come to our help, we have been able to cover a large part of population in probably a shorter time, or probably in a more effective manner, in a way which he comprehends, which he associates with. The idea is the viewer has to associate with the idea. What are you talking? What are you wearing? What is the idea? What the language, the music, and everything. So that is one thing that is an advantage for us, and we are doing that. But much more needs to be done, like you said. Much more needs to be done. So
Thank you. I think the vaccination, the need for vaccination, and you know, that is something, a message needs to be amplified manifold.
Absolutely.
And also the fact that, see, we've given crores of vaccines now. Still people say, इससे कुछ हो जाएगा. नहीं हो रहा है. You know, it's not as if we've given a few thousand or even a few lakh. Crores.
I believe the number
30 crore से ऊपर, 30 crore से ऊपर.
35.
Correct me if I'm wrong, but I believe it's
35. आज 35 हो गया.
Yeah, and every day more than 50 lakh are being given every day. So we have to overcome this vaccine hesitancy.
Absolutely.
As you know, Rommel had said. Otherwise, you know, the unvaccinated will get infected, and then the virus can mutate into something which may escape the vaccine. So then it comes to the vaccinated. So that is a message which needs to be amplified and told and retold again and again.
Absolutely agree with you. Like I was mentioning, the naysayers or the pessimists are always on to it, you know, that it take us 10 years to cover the whole population.
No.
कुछ ना कुछ उनका है बोलने का अपना, whatever best interest they have.
See, from next month onward, you will have. From next month onward, you will have 1 crore and more being vaccinated every day. You know, we've shown that 88 lakhs we did on one day, irrespective of what people may say. It is this infrastructure only which was capable of doing it. And the private sector on that day, again, it's a message I want to give. The private sector was present only in 2,000 locations out of 60,000.
Right.
So once the private sector at the peripheral level is able to get the dose, we will cross 1 crore very easily. So we will be able to achieve, you know, adult vaccination at least 90%, if not 100%, by end of December. So with that, I won't take more time. We are 25 minutes over. Back to you, Chairman, sir.
Thank you so very much, Dr. Harsh, for so smoothly and so intelligently and so warmly steering the whole thing. Thank you, Dr. Sameer, for making us all very happy and giving us all the positivity and all the hope. And Dr. Rommel for standing with us that you will take care if need be. And thank you, Dr. Balbir. Thank you, Dr. Bagai. You have been very kind, very helpful. Thank you, Amod, once again. And I'm sure all these doctors would continue to be available to the students, to the academia, to all of us in the coming days, if at all need be.
We are willing to become honorary professors in your institute, sir.
So they can't be big offer to us. Grateful, sir, very grateful. And only now
I'm willing to become an honorary patient.
Yeah, right.
I would be honored.
Don't say that.
Yeah. One final word to all the people. Just kindly listen to what these most distinguished doctors have told you, most experienced doctors have told you, that there's nothing to worry. There's nothing to worry at all if you just take precautions. Just take your vaccination, wear your mask and be on your own. The future is in your hands. Future lies with you. And as Dr. Harsh said that जितनी ज्यादा तेज गर्मी पड़ती है उतनी बढ़िया गेहूं उतनी बढ़िया कनक पैदा होती है. So you have passed through the worst. You already have faced this scenario. So future in any case is going to be bright and brighter for all of you. Just take these basic precautions and be happy in life. Thank you very, very much, sir. Thank you very much.
Thank you, sir.
Thank you very
Very,
much.
very great.
Thank you, everyone.
Thank you so much. All the best to you.
Bye,
all.
Nikhil.
Thank
Bye,
you,
Shivani.
Thank you.
Bye,
Nikhil.
bye, guys.
Bye, sir.
Bye, guys. Bye,
Thank you all
everybody.
the
Bye. Thank you.
participants. Thank you, everybody. Thank you,
Bye.
Dr. Sambir and Dr. Bagai once again in absentia. Thank you very, very much.
Thank you.
Thank you. Thank you.
Thank you.